Welcome to the dvm365. Give us 5 minutes or less and we'll update you with the veterinary news, medicine, and business information you need to know right now. I'm Dan Verdon. We're delivering this edition of The 5 from CVC San Diego, where veterinarians and their teams gathered to take in more than 550 hours of continuing education. In this edition, we'll learn about the first H1N1 case in a cat, focus in on student debt and the economics of practice, get a tip that could get you home on time, and more. First up, could you tell if a cat has influenza? How would you know? Immunologist Dr. Craig Datz explains when you might test a cat for H1N1.
What do we look for in a cat that's sick cats oftentimes just stop eating and are depressed, and that's just a sick cat. So when should we test for H1N1, or should we test for H1N1? My guess is, and this is all just speculation, that if there's known exposure, if you're sure that there's people in contact with a cat that have had the flu, which whether or not it's worked out to be H1N1 or just the flu, and the cat has respiratory disease, possibly signs of pneumonia, it might be worth checking the cat for H1N1.
Student debt increased 8.5% over last year, with the average student owing nearly $130,000 upon graduation. That's according to a new study from the American Veterinary Medical Association. And more than a third of new graduates owed more than $150,000. These financial realities influence the choices new grads will make down the road about what jobs to accept or whether to buy a new practice. We get some insight into how these issues could play out for practice owners from Dr. Michael Andrews, who participated in the DVM Newsmakers Summit at CVC San Diego.
So I would hope that they'd consider their debt as they're going along, that they would try and find a good practice to start out in to give them the fundamentals that they'll need to be successful. And again, I would encourage them certainly to consider AAHA hospitals, and then to consider ownership. Even though they may have some debt, it's a possibility, and I think they should consider it strongly for their futures.
Dinner's on the table, and you're not there again. Tired of getting stuck in the practice at the end of the day? Management consultant and practice owner Dr. Ernie Ward offers his help.
When it comes to going home on time, I think veterinarians first and foremost need to understand that this is not a perfect world. There are going to be days when you have to stay late, okay? There are unforeseen emergencies. What I'm interested in is the 80% of the time when I can control my schedule and I can actually try to get out of there with some semblance of normalcy. And so the number one thing I think that vets have to do is know the schedule. You can't control something that you don't know. So at our hospital, every team member, doctors, technicians, receptionists, we know the next 3 appointments, what they're coming in for, who's coming in, and that helps us stay on schedule. And also if we find that we're running a little bit behind, by knowing the schedule, maybe we can make up some time the next time. But the number one tip I've got for going home on time is simply knowing your schedule.
We asked speaker Sean McVeigh to give a quick overview of the topics he covered during his talks in San Diego. One hot issue, doctor pay. Here's a look.
We've had really interesting sessions. Yesterday, I spent time with a majority of my audience being doctors, which is something new. In the last 15 years, as I've been talking about management, I've slowly seen doctors start to come around and believe and talk about management. The 2 themes yesterday that were of most interest to our attendees were, A, how do I compensate my doctors? There's a lot of talk now about how do I actually get the most out of my doctors. So we spent the time talking about the 20% of time that doctors don't do doctor stuff. How do you pay them for that, or how do you not pay them for that and turn that money into profit for the practice or wages for other employees? So that was fantastic. And the second thing that we talked about that was really big was leadership for the doctor. It ties to the first because what we're learning is that really great practices don't work well unless the doctor is a leader, and we've got to figure out a way to make that part of the job description. So greetings from San Diego. You can tell that the weather sucks. Hope you're doing well wherever it's snowing. Bye.
That's all for this edition of The 5. If you've enjoyed this broadcast or have suggestions for future shows, please send your thoughts to dvm360@advantstar.com. And for the latest news, medicine, and business information, be sure to visit dvm360.com every day.
Really want to be Oprah. I'm serious. Not really, but I want to be,